How many patients make mistake by using inhalator?
In the Czech registry of the patient with COPD, we have the information that approximately 70%, maybe more, 75% of patients with COPD have the critical errors during the inhalation.
And which kind of errors do they do?
The most common error is absence or incorrect exhalation before inhalation maneuver. This is the very common, minimally in 40% of patients. And the second common is the wrong duration and intensity of inhalation and mixture between the inhalation of the aerosols and DPI. DPI should be inhaled very fast and deeply, approximately 1 second. And contrary, the soft mist inhaler or aerosols have the longer time, 4, 5, maybe 6 seconds on the very quiet inspiration. And majority of the patient make something between this, some mixture, not fast, not longer, but something between, which is totally incorrect.
How can we improve that?
The biggest and most simple way is the repeating training, very patient discussion between the physician and patients, and maybe pulmonary rehab with the multi-component items. For example, patients in the rehabilitation program in my hospital have every week 2 hours of the rehab and 1 hour of the inhalation training with ergotherapy and training of the self-assessment or self-evaluation of the worsening, like the exacerbation. And if a patient have this rehab during 8 weeks, after 8 weeks, the knowledge of the inhalation technique is dramatically improved.
What about the relationship between patient and doctors?
Majority of the doctors are in the stress and in the hurry, and also myself. Last day on Friday, I have the 5 activities during one time, and this is not good because if we have no time for patient have no opening of the mind, no opening of the brain, and information are not frank. A majority of the patient, if watch on the doctor, which is in the hurry, have no tendency to be open. And this is the simple way, and this is the have the more time for patient, for clever discussion and face-to-face discussion about the problem. And if patient feel the time of the doctor and if feel the interest of the doctor, the opening of the brain it's very open and very often and very fast.
Do patients talk sincerely with the doctors?
We have information from the US study with name Mirror. This study, it was the mirror patients and physicians, and from this study we have a clear confirmation that majority of the patient, approximately 90% of patients with COPD, have no open mind during the visit in the office of the physicians, and physicians don't identify this patient correctly. Sometimes patients said, okay, all is okay, I have no worsening, no episode of the breathlessness, but the truth is totally different. And this is the same problem. We need more time and more interest to the real patient complaints.